Hey folks, welcome to First Coast Living. I'm Curtis Dvorak.
And I'm Angelia Savage.
All right, well, we're starting right out. Are you struggling with an irregular heartbeat? Well, it may be time to consider a new approach when it comes to your treatment.
And Dr. Saumil Oza is the Chief of Cardiology at St. Vincent's Medical Center, Riverside. Welcome to First Coast Living.
Thanks for having me.
Nice to have you here. And we wanted to get right into what actually AFib is. Atrial fibrillation is a big deal. You're saying 1 out of 4 people actually have it. But what does it really mean? Yeah,
after the age of 40, about 1 out of 4 people are expected to get AFib. AFib is really an irregular heartbeat stemming from the top of the heart, the top 2 chambers called the atria. Instead of beating 60 to 100 times a minute, it beats 300 to 400 times a minute, and instead of squeezing in sync with the bottom chamber, it just sorts of fibrillates or quivers. So that leads to a lot of different problems that are associated with atrial fibrillation.
And that's something every patient feels, or not necessarily?
About half the people feel atrial fibrillation. The sensation, I often am told, is a fish flopping around in their chest. It can also lead to shortness of breath, fatigue, symptoms of heart failure like swelling in the legs or fluid accumulating in the lungs. And then the most severe consequence is stroke. Obviously, you don't know about that until you have one, unfortunately. About half the people don't feel their atrial fibrillation, and that's just as dangerous because of the risk of stroke if you don't know you have it.
What currently, right now, and historically, what have been the treatment options for this?
Historically, far in the past, it was just really living with atrial fibrillation, and then we use anticoagulation or blood thinners such as Coumadin or warfarin to prevent the stroke. Then we came out with medications that could keep people in normal rhythm. Unfortunately, those medications also have side effects that are quite severe, the worst being cardiac arrest or sudden cardiac death, which is associated with these medications. So there hasn't been a really great way to treat atrial fibrillation until some of our interventional procedures, such as atrial fibrillation ablation, which uses a catheter to actually cauterize the areas of the heart that cause atrial fibrillation. The convergent procedure, which we're talking about here, is a more advanced procedure where we work with the cardiac surgeons who ablate or cauterize on the outside of the heart, while we go in soon after and cauterize on the inside of the heart and take care of even more advanced cases of atrial fibrillation. So now we have an option for the whole spectrum of atrial fibrillation, from early atrial fibrillation to people that have long-standing persistent atrial fibrillation after
Converge, the name of the procedure, just a combination of technology and actual physical, like you said, 2 teams, one working the outside of the heart, one working the inside. This is the pictures you saw. That was amazing. Yeah, no, it's a really unique collaboration we have with the cardiac surgeons, and we're able to really offer the full spectrum of treatment with that. The procedure itself is called the convergent procedure. We're doing a trial now called the Converge trial, in which we're kind of trying to see where this procedure fits in best. We know that it works well for the longest standing advanced patients with atrial fibrillation, but our results have been so good that we want to see in those patients that have kind of that intermediate range atrial fibrillation. So not early atrial fibrillation, but kind of 7 days to 1 year, that range, if this is the best thing for them, because we have pretty good results with catheter ablation alone, but we want to see if we can do better.
And you were saying that we were looking at the screens and looking how it was saying it was minimally invasive, going back to the procedure, convergent procedure.
Yeah.
How long are we looking at for recovery? Because it didn't look difficult there.
Yeah.
But I'm sure as a patient, what's the recovery time? Exactly. So what are they really looking at?
So you're in the hospital after convergent procedure for about 2 days. Generally, probably 95% of our patients leave after that. For about 3 weeks, we ask our patients not to exert themselves significantly, like exercise, but they can go about their daily lives pretty much as soon as they get home. They can do all their daily activities, but just not lift or exert themselves significantly until about 3 weeks.
Who would be the best candidates for this? Because obviously not everybody can go through this. But who are the best ones that? So
right now we really limit ourselves to people that have symptoms of atrial fibrillation. So if you have atrial fibrillation and it's symptomatic with shortness of breath or palpitations like the fish flopping that I was talking about, those are the patients that really we try to treat first with these types of procedures. If you don't have any symptoms, the jury is still out as to whether or not we should be doing ablations on those patients. So in only select patients do we do that procedure on those types of patients.
I think this trial is interesting that you're talking about, the Converge trial. How do people actually qualify for that, though? So if somebody's at home thinking, I know I have this new AFib that's they've discovered in the last week. What are your thoughts on that?
So you could qualify even for newly discovered AFib. Generally, we ask that you have at least tried one medication to keep you in normal rhythm. We also make sure that the patient hasn't had a previous ablation. For trials, they want to be very pure in terms of the types of patients that they have in the trial, so we actually answer the question that we're getting at. So that's really, the criteria aren't that strict, but those are the two things that we really look to see.
But it can save your life.
Absolutely, yeah.
All good information.
Yeah.
Appreciate it, Dr. Oza.
Thank you so much for having me.
Yeah.
Appreciate it.
And we want to thank the Converge trial for being here and sharing this information. To learn more about the AFib trial, please visit afibclinicaltrial.org or call 888-905-AFib, which is 2342.